What's up, guys? Brad Fizz here today, and today we are going to be talking about the thoracic, the cervical, and lumbar vertebrae. And we're going to be talking about the diagnoses that come from the spine. First off, I'm going to start with paraspinal, and that's when there's a lot of pressure on your back, causing your thoracic spine to close in. And again, for your muscles in your back to be stressed, along with your spinal cord goes down to the tailbone, but it doesn't affect the tailbone. It affects the part of your back where your thoracic spine is, and your iliocostalosis, your spinosus, and your longissimus, which goes along with your back anatomy. And the next thing after we go through paraspinal, I want to talk about scoliosis, a 20-degree angle thoracic spine. And this is, again, really, really, really bad for some exercises. If you don't actually strengthen your back, strengthen your posture, then you're not going to be able to perform these exercises correctly and be functional in these exercises. And I talked about that in the other video, the scoliosis and kyphosis video. Please, guys, go on that. Next thing up is kyphosis, 45-degree angled back, and that is a hunchback. Scoliosis is a curvature in the spine that's causing it to move from right, mainly, leaning forward, not backward. And kyphosis, of course, is really bad now. Kyphosis is worse than scoliosis because it can really, really, really affect your posture. Your spine is always going out like this, and the major thing about kyphosis is when you're looking at a 45-degree angle back, is that the shoulder blades and your spine is going to be hunched. So your shoulder blades are not going to be proportioned correctly with your spine. They're going to literally just stay, not going to move back in any sort of way. They're going to go down. They're literally going to stay there, and it's going to put a lot of pressure on your thoracic spine and your levator scapulae, which is in your neck, in your atlas, which is the bone right here that connects to your cervical. But next thing we're going to be talking about, after I just explained paraspinal, scoliosis, and kyphosis, the next thing I'm going to talk about is Syrinx. Now, Syrinx, maybe people don't know of this. Now, Syrinx is actually when you have a cyst growing out of your spinal cord and your tailbone too. So it goes up from your spinal cord that leads into your thoracic spine. It again causes major problems with your iliocostalosis, your spinosus, and your longissimus, which is in your back. And it's going to affect your posture. It's going to affect how your shoulder blades, how they move. It's going to affect how your tendons move when you have a cyst. Because when you have a cyst, there's this area, it's really big, it's inflamed, and especially in the spinal cord, I'd say this is the worst circumstance that you can get yourself into, is when the spinal cord is growing a cyst out of it directly in the thoracic spine. There's going to be a lot of pressure there, and you're not going to get a lot of mobility and stability, and that's why you really have to focus not on stretching, but your posture, and that's the main thing for all of this is your posture. the positioning of your back, the angle at which you're standing. And the next thing we're going to talk about after we just talk about paraspinal, Syrinx, talk about Scoliosis, Kyphosis, and what other diagnoses are there really within the spine? So herniated disc, that's a major one right there. Bulging disc and protruding disc. And I'm going to go through each and every one of them. So protruding disc. Of course, your disc is back there. It connects to the sciatic nerve, and when it's protruding out, that means it's disconnected from your sciatic nerve. It's literally falling out of that socket that it's supposed to be in. Your disc, which again, it can cause it to protrude out, cause it to not be in place, not have the correct connection to the sciatic nerve. And this is going to affect this is a motorcycle. This is going to affect arched backs, which many of us have. You know, when we get in a position like this, we arch our vertebrae, which we're extending it, but we're literally putting a lot of pressure on it. We're bending it, which that is the major thing that you don't want to do with your vertebrae, because this is going to cause those discs to be out of place, to be out of the socket from the sciatic nerve. And stenosis, before we get into the rest of this, stenosis is narrowing of the spinal canal. So it's kind of narrowing in through your lumbar, your thoracic, and cervical vertebrae. And stenosis is going to affect your posture, as I've talked about through this. But stenosis is, of course, narrowing of the spinal canal. It's going to also affect your sciatic nerve, which is connected to your glutes, which goes up into your lumbar vertebrae and leads to your thoracic and cervical vertebrae. And this is going to affect how much space you have, how much room you have to actually move your shoulder blades, and to actually make sure that you're having a really good posture, posterior posture, make sure that it's not really anatomically done, it's not a standard posture, that we just don't put any tension into it, we just sit there in that posture, like that, internally rotating your shoulders, which most of us do when we don't care about posture. We lean back, internally rotate our shoulders, which can ultimately affect the chances of getting bursitis, tendinitis of the bursa, disabling the bursa from use in the shoulder subscapularis, which is right there along supraspinatus, your humeral head, your humerus, and your labrum, which is all connected here, in your acromial that comes up here to the clavicular structure, the AC joint, that is along these shoulders right here, and the scapula, which, as I just explained, stenosis is really, really bad to have along with these other conditions that I'm explaining right now. And what's a bulging disc? So a bulging, and this goes along with herniation too. So when you get a hernia, of course, your back is going to be affected, your spine is going to be affected. You're probably going to have a higher chance of getting a pinched nerve, where it's going to be putting pressure on your nerve, the spinal cord, your tailbone, as it go down to your glutes, to your sciatic nerve. And a bulging disc is when you can see the disc. It's bulging out. It's really you can feel it, and it's inflamed. This is when it's inflamed. This is the second to worst state that it can be at your disc, because it's going to be bulging. You can see it, and protruding is really worse because again it's out of the socket. But bulging, that is bad too. Now herniated disc. What is a herniated disc? And so when we talk about herniation, the things that come to mind are the abdomen and the back. If you get a herniated disc, you put pressure on that disc, which again, bulging disc, herniated disc, and protruding disc all get pressure put on them, and they usually come out of the sciatic nerve. It messes with the flow of the actual discs that are in place in your sciatic nerve that goes down to your glute medius, your glute max, your psoas, and iliacus, and your sciatic nerve, which again goes down there. And a herniated disc, it's a little bit different from bulging or protruding disc, because if you know what herniation is, if you have diastatis, which is again when your linea alba, which is right here along with your rectus abdominis, transverse abdominis, along with your abs. So the herniation is going to cause some sort of inflammation, and this is really bad again for your abdominal structure, your muscle structure, in your chest, your upper lower body, mainly your lower body right here through your abs. And it doesn't really affect obliques too much, or the serratus, which that is good. It's not affecting that. But the herniated disc, of course, happens in the back, and that disc is going to be out of place, and that's the main thing right there. It's going to be out of place. It's not going to be. It's going to be attached to the tailbone, but it's going to be a little bit off. It's not going to be fully detached, but slightly a little bit off when it's supposed to be attached right on. And herniation diastatis is again, it actually affects where your abs are going to be. It affects the placement of your abdominal structure if you get diastasis. And herniation is mostly known when you get this inflamed area. It's a big pile of liquid, I would say, but it's literally just a ball, and it pops up, and then you literally the doctors have to remove it. Surgeons have to specifically remove the direct place where it's herniated at, where you get the herniation, and you might get a lot of these, and again, it's going to affect your physique. It's going to affect your abs, because you're going to have that kind of scarring again if you get the surgery of that. And surprisingly enough, I was looking up one time about this kid, Ayla, had a big appetite. He actually had this, and it basically prevented him from gaining weight. If anything, he lost a lot of weight from the herniation within his abdominal structure. And guys, after we just explained that, I'm going to wrap up this video with that. And in the future videos, I want you guys to tell me what to do. I'll be sure to listen to your ideas and what you specifically want me to do within the field of health and fitness. If you have any questions for me, ask them, and Bye guys, we're gonna finish up.